So let's transition here to stroke. Some people have loss of limb use because of a stroke, and we've seen this slide before, and that coronary heart disease is about half of all cardiovascular diseases and deaths from them. But stroke is a pretty big percent, so it's about 16.5%. So a stroke, and looking at the numbers, the increase in stroke prevalence by age, of course, just like many of the other conditions we have, it does increase with age. Note that it is not non-existent in people 20 to 39 years old. So the prevalence is very small, but your risk definitely goes up with age, just like many of our chronic diseases that we've studied this semester. But starts to, especially interesting if you look in the 40 to 59 age group, that women are significantly higher than men. And then at 60 to 79, they're about the same. And then older, it's more men than women. So what is stroke? Basically, also known as a cerebrovascular accident, CVA. It is a number one cause of disability. Basically, it's a heart attack in the brain, for lack of a better word, or blood flow obstruction in the brain. And so it's a rapid loss of brain function for at least 24 hours. And there are two different types of stroke. So the ischemic stroke, so that is the blood clot or an embolism disrupts blood flow. So that is sort of like the equivalent of a heart attack, but it happens in the brain instead. So that is the most common. And then there is the hemorrhagic stroke, where a person has bleeding in the brain due to rupture of blood vessels. So there's some sort of weakness or malformation in the blood vessels in the brain, and so the blood vessels burst and there's bleeding in the brain. So the treatment effects and how they treat them are going to be very, very different. And even certain hospitals in the region, the Novant, there used to be the Presbyterian Hospital in Charlotte, they are really more the stroke center. So if you're having a stroke, you probably want to be transported to the former Presbyterian, now Novant Health Hospital. So it does make a difference in how they are treated. The main thing we have to be concerned about are the after effects of stroke. And for those of you who want to work in physical or especially occupational therapy, you may see a lot of clients who are post-stroke. So what's interesting is that the person has paralysis and damage on the opposite side of the body from where the stroke was in the brain. And people will often have long time disturbances with coordination. If they had a stroke near their cerebellum, they may have difficulty with walking, may have difficulty with balance. They may have lack of feeling, so they may have some numbness in that area. They may experience pain. Some people lose the ability to speak. That's known as aphasia, so you can't speak, or they may have difficulty speaking, so they may also need to have some speech therapy as well, along with occupational therapy. There may be some memory loss, emotional changes, so fear, anger, decreased range of motion. They're going to have hypertonia, so they're going to have more flexion, so the muscles are going to be more spastic. The muscles may also be weak. People who have had a stroke also get very fatigued very easily, and so they're going to have a lot less of endurance.